Every day, in operating rooms across the country, thousands of surgeries are performed by a team of dedicated professionals with one goal in mind: a successful outcome. However, to most patients, the critical role of each member of that team may be as obscure as the faces behind the mask.
The surgical team is a multidisciplinary group. The members of the surgical team are physicians, which can be the surgeon or the proceduralist, the anesthesia provider, which can be a nurse or a doctor, the RN, which does primarily the circulating role, and then the technologist in the scrub position. The nurse also can be in the scrub position.
Perhaps one of the most misunderstood unsung heroes of that team is the perioperative registered nurse. This nurse plays a crucial role before, during, and after any surgical procedure.
The role of the perioperative nurse is to care for the patient in all three phases of their surgery or procedure. Preoperatively, to assess the patient for their unique needs; intraoperatively, to act as the coordinator of their care and advocate for their safety in their environment; and postoperatively, to prepare the patient for discharge either to home or to the nursing unit.
A perioperative nurse is critical during a patient's recovery, when they are often anesthetized and unable to properly care for themselves. Hospital administrators agree the importance of qualified nurses cannot be overstated, yet today, most facilities in the U.S. are facing a critical shortage of nurses.
There is a nursing crisis in this country due to the aging of the workforce, particularly with the baby boomers facing retirement. There are fewer students in nursing schools due to the lack of faculty. So we're very focused on encouraging existing nurses to go into education, young people to enter nursing, especially the minorities and men.
Professional organizations such as the Association of Perioperative Registered Nurses are making strides to turn the tide of the nursing shortage through outreach and education.
AORN has been very supportive of the Student Nurses Association, both monetarily and to offer speakers at their national meetings. In addition to that, Perioperative Nurse Week in November offers the opportunity for our chapter members to be in public places all across this country to talk about nursing and what perioperative nurses do to keep them safe. And we believe that getting students at the early age is really important to encourage nursing as a career.
Nursing is a physically demanding career, which experts agree can be emotionally draining. Yet for those who have chosen this profession, they say rewards outweigh the challenges.
I chose nursing because it's a caring field. I feel that it's important to be able to provide for people. I chose perioperative nursing because it's a point whenever you get to be a voice for your patients and advocate. Advocacy is a big part of nursing.
I chose to become a nurse just because I wanted to help people. It's something I love doing throughout my life because it just makes you feel so good whenever you help somebody. And I became a perioperative nurse because there's so many different things you get to see every day. Different types of surgeries and different ages of patients that you get to take care of.
By giving nurses the support they need, nursing organizations can improve patient care and the quality of health care for all.
Being a member of AORN has helped me in my practice by allowing me to continue my education and find what are the best practices being provided out there. They hold Congress meetings. Every month our local chapter has educational offerings. It provides a resource of everyone coming together to define what is the best for our patients.
My membership in AORN helps a lot because every month they have a magazine that comes out with new products, new technology. Every month we have a meeting in which we have a speaker that talks about all the advances in healthcare and all the new technology that's coming out. You get to meet all the other people in your field with the same passion as you.
The future of nursing is very bright. Considering the growth in technology, the nurse will bring a human touch to a high-tech environment. As advanced practice nurses, we will act as physician extenders to care for patients on a primary care basis.
A trusted hand, the scalpel and suture. These are the most important tools of the surgeon. Skill, knowledge, and a caring touch before, during, and after your surgery. These are the tools of the perioperative nurse.
My son Sam was in a lightning strike accident that put him in the hospital for many days. Each time we would go down to the OR, we were greeted by one of the OR nurses. She got to the point she knew us by name from the very first surgery all the way to probably the 15th or 16th. We felt like our son was in good hands because of just their knowledge and education and their dedication.
Since 1954, the Association of Perioperative Registered Nurses has been working to advance the practice of nursing and improve patient care and safety before, during, and after surgery. AORN is a recognized authority in developing and implementing safe operating room practices and is considered the preeminent resource for information to support and improve the day-to-day practice of surgical nursing.
The mission of AORN is to promote patient safety and optimal patient outcomes. We do that by providing our membership with professional development, continuing education, and development of research-based, evidence-based standards of practice to assure the quality is there.
AORN has developed a PeriOp 101, which is an online course for the novice nurse who wants to be an operating room nurse. We also are embarking on a project which is a standardized perioperative medical record, which will allow the nurse to document all of the necessary important information about surgery for the patient.
Open the double doors to an operating room and you enter another world. Nobody understands this world better than the perioperative nurse and AORN. The skilled and experienced consultants of AORN can assist facilities in dealing with the complexities of infection control, sterile processing, scheduling, utilization, interdisciplinary relationships, HIPAA compliance, and much, much more.
AORN has been very active in endorsing patient safety. We were invited to the World Health Organization meeting in Geneva, where the surgical checklist was first discussed, and we endorsed that along with over 200 countries across the world. In addition to that, the Joint Commission recently rolled out an initiative for the Universal Protocol, and AORN has endorsed this also.
With a focus on positive patient outcomes and putting patient safety first, AORN is dedicated to creating a quality experience for all surgical patients and to revealing the caring faces of the men and women behind the mask. For more information, log on to aorn.org or call 800-755-2676.